Hello, my name is Becky Mantle, and I am an International Board Certified Lactation Consultant, or IBCLC, and Clinical Assistant Professor here at the University of Oklahoma Health Sciences Center. I lead the Oklahoma Breastfeeding Resource Center for the university. And I'm here to talk about some kind of controversies during this National Breastfeeding Month and this week's theme of breastfeeding during emergencies and natural disasters. Well, we certainly are in the middle of a global pandemic, and what better theme this week than to talk about breastfeeding during a global pandemic. It certainly has upended all of our lives and made us question the safety of some normal everyday activities, and particularly for moms and young babies. So one controversy, of course, is for the woman who's pregnant right now and expecting to go to the hospital. What's going to happen around time of delivery? What if I'm COVID positive? And what about breastfeeding and skin-to-skin contact and all these things that I would expect to happen? So that's what I wanted to really talk about today. What we do know, first off, is these are important. Please wear your mask. Please protect yourself and those around you by wearing a mask, and especially during pregnancy, because we do know that there's more evidence now that women who contract the COVID-19 infection during pregnancy, can have more severe illness and complications during labor and delivery. So follow all the guidance to avoid large gatherings, and encourage all of your family members, your little bubble of family, and support people to do the same thing and wear masks and do hand hygiene. So anyway, but what's going to happen when you go to the hospital, and what happens if you in spite of all of that, do test positive for COVID-19 at time of delivery? Well, I'm not going to talk about the labor and delivery side of things, but more about what initiating breastfeeding and what should happen there. So frustratingly, we're getting some different recommendations. The World Health Organization strongly recommends keeping mother and baby together even if mom tests positive for COVID-19, unless she's too ill to care for her baby. And then separation might be a better thing to do if mom physically cannot care. If she's so sick, she may need to be in the ICU herself. But otherwise, mildly symptomatic, or mom with no symptoms, WHO says still do skin to skin, but of course wear one of these, and hand hygiene, and all of and then social distancing, of course, protecting you and your baby from exposure through other people. So now our own Centers for Disease Control has changed their recommendations over the past few months, and is now kind of in line with the American Academy of Pediatrics in recommending immediate separation of a healthy baby from his or her mother if the mother tests positive. So in my professional opinion, I think a lot of other evidence about the negative impact that can have on the mother and the baby and the success of breastfeeding, needs to be taken into consideration as well. There has been no evidence of the coronavirus being transmitted through breast milk, so we of course still encourage breastfeeding. There's been no evidence of vertical transmission, during time of delivery. So, the babies that we've heard so far, have been exposed, as everyone is, through respiratory droplets, from other people. So now, looking at, what is your option when you go to the hospital? Well, it is your right, it's the mother's right, the family's right to make the decision on whether they want the baby to be taken away and cared for by healthcare staff, or stay in the room and cohort the mom and baby and dad or support person together in the room, and with everyone using appropriate PPE, of course, wearing masks, hand hygiene, and so forth. And ultimately, you're talking about separating a mom and baby during this critical window of time where skin-to-skin contact is so important for that newborn's transition and avoiding complications, and is the successful initiation of breastfeeding. We know separation leads to breastfeeding challenges. We're more likely to be supplementing the baby with formula, and we may end up, completely disrupting breastfeeding for the long term, which, is protective against the coronavirus. So I think families need to know that you can listen to the recommendations, and in Oklahoma it's about 50-50 right now. About half the hospitals are going to keep you together, and about half the hospitals are going to recommend separation. And you need to know that it is your right to listen to the information and then decline if you think you would feel better, you want the baby to stay in the room with you. I also want to remind everyone, who's the baby going to go home with? We're going to separate for 2 days in the hospital and expose the baby to more healthcare workers in the hospital, and then we're going to send the baby home with the family anyway. We're certainly not going to tell the mother she can't get around her baby for 1 to 2 weeks, unless she's too ill. So anyway, I think once again, avoid, if at all possible, being exposed. Wear your mask. Hand hygiene, social distancing, avoid large gatherings, protect you and your immediate family members, and then your baby. So when you are able to bring that special new little person home from the hospital, that you will be, you will have had a good start to breastfeeding.